My name is Cathy Pratt, and I'm the director of the Indiana Resource Center for Autism. And my colleague is
Rowe, educational consultant with the Indiana Resource Center for Autism.
and we're located at the Indiana Institute on Disability and Community. And at the bottom of the slide is our website address. And I would really encourage you to go onto the website. So we're going to be talking about behavior today. And my child is misbehaving. So now what? We did a needs assessment survey a couple years ago, and we asked some questions of family members about their sons and daughters on the autism spectrum. And so what we know, according to the Centers for Disease Control, is that the incidence of autism is now 1 in 44. But I think what's particularly important for you to realize is that 78.2% of our respondents reported that their child has something else going on. Number one was ADHD, followed by anxiety and others. And so I think, my colleagues and I in the field of autism talk about the changing face of ASD because we have so many more students and children who have co-occurring issues going on. And we know that mental health issues occur, and we also know that anxiety is rampant for many folks. So I think the moral of the story is that oftentimes there's not going to be an easy answer. So the most common call we receive is related to behavior. Questions about how do I deal with this behavior, or what do I do right now? And understand that there may be many factors that are involved in behavior, and we must understand and know those factors. So because behavior is really related to context. So how your child behaves at school is going to be very different than how they behave at home, which is true for all of us. But the other thing that is important for us to understand is what our hot buttons are. I tell folks that my hot button is kids who whine. I have a hard time with that. So I think we have to understand our own hot buttons, because how we respond to behavior is also going to have an impact on behavior as well.
And Cathy, just to say that there is that difference between reacting and responding, right? So when
Right.
we react, that's when we're not thoughtful and we become impulsive with how we intervene or handle it. Where responding really is taking everything into consideration. And so not just off the cuff, because that can escalate those pieces. So just being responsive versus reactive.
So the question that we often get is, what do we do when a child is hitting, they're kicking, they're throwing things, they're refusing to do work, they're putting their head down? And I agree, I think one of the things that is really important is, even within the context of a family, is to have some kind of a plan that the adult members in the family have a conversation about how are we going to respond to this behavior. Because what we know is that when people are inconsistent, it only strengthens behavior. So that, for example, if you have teenage kids and one of your teenager comes to the mom and says, "Can I stay out until midnight?" And the mother says no, but then she goes to her father and the father says yes, then that child has just learned to shop their parents in the future. And it's just strengthened their resistance to taking no as an answer. So as consistency is going to be key in everything that you do. Betty Lou.
Sure. So when we talk about their toolbox, we mean the child's toolbox, and that toolboxes are going to change depending upon could change depending on the age of the child, or as they grow, their toolbox change. You yourself have your toolbox of what you do to aid yourself around your emotions and your own behavior. And so one of the things that we really stress when we think about dysregulation is naming that emotion, and the feelings and emotions and all of those pieces we know can be challenging for our friends on the spectrum, but it doesn't mean we don't do things around that, because we don't want to ignore that because it's challenging. And we're not saying we're teaching emotions when we're in the middle of maybe the episode, but naming the emotion is going to be important. Validating the emotion is going to be important, that it's okay to be angry. It's okay to be sad. But what do I do with that emotion? That's the most important thing too, is that once you name it, what can you do with it? Not say when we're angry, we don't kick. No, when you're angry, you can do this. And so what do they need to be able to get through those emotions? So definitely naming it. things like also reading books around emotions and feelings. And so some examples could be the Grumpy Monkey series, which has younger, harder hardcover books for younger children, and it also goes into a leveled reading series. So Grumpy Monkey. Breathe Like a Bear is something that it's for maybe our younger kiddos, but you can take all of these concepts and move them into older kiddos. You're just going to have to be a little bit more creative with that. But Breathe Like a Bear just talks about breathing as a way to regulate. Thank You Mind, because a lot of the understanding of the emotions happen also through the brain, and just what can you do to help regulate from there. The Day the Crayons Quit is a really humorous and great book. And it talks about, they don't like how they're being used anymore. And so it goes through that from their perspective. And so you can take that book and also kind of put that into context for some of the things that are going on with your kiddo. Big Feelings is another book. The Collar Monster. Be Strong. Be Strong is, is around being, persistent, perseverance. So it's a great book around that. A Little Spot of Emotion. And I actually have my box set, and they can come individually or as a box set. And they have different emotions that you can access through that. And then the other series is called Ninja Life Hacks. And this is actually the Impulsive Ninja. But if you go to ninjalifehacks.com, ninjalifehacks.tv, the Mary Nin is the author, and she does a lot of different things through that website. She has videos and reads some of the books and so forth. So I really like this series as well. It's very engaging. It's short, sweet, very colorful. So just thinking about other ways like through books. And then be proactive by planning for the support to stay calm and regulated. So what works with your child, for your child? Do they soothe better alone, or do they need help with this? Do they calm better if they're doing something like they're building or they're drawing or they're putting things in order? Like what helps soothe them? Or just being? Do they just need a quiet space to sit and have no one interact? Remember that this is not the time that I'm going to be teaching around like, hey, what you could do next time. They need to be in that space of calm, like after that you see them start to transition to, hey, now let's talk about what happened. And when I say talk, that could be in a very visual way, which is bring those books in or have them draw it out or do some of those pieces with them. Do they need to get the emotion out by squeezing something or pounding on a pillow? If that's something that helps them, then we say designate a specific pillow for that. So we don't want them doing that to every pillow in the house. But if you're like, all right, this red pillow, this blue pillow is for this, we start teaching them when you need to do something like that, use this pillow. And if they start to get a little excited that they're going to go for that pillow, you slip that pillow that is going to be their replacement right there for them. Or do they need a pace? Once again, that might be something that helps them soothe and regulate, but designate a space, because if they're sort of pacing all around your house, that can also be interfering and distracting for others. But if they have that space, whether it's in their room, whether it's in the basement, whether it's in a certain area of the house that you want to designate for that, or a section, you kind of put tape down and you can be in this section to do whatever you need to do. So those are ways that you could start thinking about their toolbox. And then also naming your emotion and what do you do when you are experiencing dysregulation, because you do as well as kids do. So if we start naming, I'm really frustrated because I couldn't get the TV to work. And this is what I do. I'm going to take a second, breathe, take in 4 breaths, and then I'm going to try it again. But you start to name how you're feeling. And then what do you do? Those are great ways to help model and start building a toolbox.
So, I think part of it is also choosing your battles, and because every time that we interact with behavior, we have a tendency to actually accelerate the behavior. And so certain behaviors may be better to ignore. I think the main thing is that when you're interacting with a child who is having behavior issues, and this is hard. I have a lot of kids in my life, but we have to stay emotionally regulated ourselves. And so we have to stay neutral. I jokingly tell people that when I'm interacting with someone who's having a behavior issue, and I have multiple grandkids and a lot of little kids in my life, I just stay in a happy place in my head so that they don't see any emotion coming from me. Because as soon as your child sees you getting upset or they see some kind of emotion happening, they've got you. I really believe that many of these children have posters of our bodies in their rooms, and they put little stick pins in those areas where they know that they found the buttons to push. And I think, what Betty Lou was talking about is we're really looking at teaching alternative skills or alternative behaviors. And I would also say, be careful of what you say in front of a child, because that, even whether the child is nonverbal or not, I know I've been working in a school and they will come up to me and talk to me about a kid being a bad kid. And I have to tell you, that just sucks my soul. So really have to be careful about what you say. So the general rule is that if a child is doing something, you warn once and then you carry it out. So, I know with my grandkids, one of their parents will say, if you do that again, you're going to have to go to your room. If you do that again, you're going to have to go to your room. And it never happens. And so what children learn then is that they can push you and that you don't stick to your word. So if you are kind of warning a child to say, if you do that one more time, you're going to have to leave the table, you have to do that and carry it out and be very consistent with that. We also are really talking about prevention, and I think prevention is always going to be better than reaction. So Betty Lewis said this a couple times, but the best time to address behavior is when behavior is not happening. And that's when you start teaching the person alternative skills or strategies that they can pull upon, or you can prompt them to pull upon when they start getting upset. And those strategies may work with other children as well. See what works. I think what we have to understand is that behavior serves a purpose. If kids didn't get a purpose or something from a behavior, they wouldn't keep doing it. Even children who engage in self-injurious behavior, whether it's biting their hands or it's hitting their head, whatever it is, they may be getting a sensory need fulfilled from that behavior. It doesn't make sense to you or I, but from their perspective, they're getting a need fulfilled. We see that some kids are driven by attention. And so if a child is driven by the attention, the worst thing to do is to try to ignore them completely. What you want to do is instead shift your attention towards positive behaviors. And then if a child is motivated by escape, what we want to do is teach them how to tell us that they need a break. And then if they need access to tangible items, that's probably telling us that they need some kind of a communication system. But what I want you to understand are that behaviors are really just symptoms of larger issues. When somebody comes up to me and says, a child is kicking or they're pulling teacher's hair, that is just a symptom of something else that's going on. So for example, I was working with a kid who was doing really well, and then his behaviors tanked. And so right away, people are talking about developing another behavior plan. Well, as we looked at him, what we found is that he had rotted teeth in his mouth. And once we dealt with that health issue, then we saw the behaviors go away. So always have to dig deeper and make sure that we're really getting to what is causing the behavior to occur.
Cathy, also like understanding too when behaviors aren't happening is very important as
Yep.
well. Like sometimes we get very stuck, and this is what it always, this because it takes over, but really stopping and thinking about when are we not seeing the interfering or challenging behavior, because that tells us a whole lot of information as well.
Yeah, that's excellent. And when I do behavior consults, and I know Betty Lou, you do this as well, I will ask questions like, when is this child the most successful? When do they do their very best? Who do they interact with the most? Who is able to have more of an impact on them? And it's true, those kind of answers can really help us putting programs together. But what we see with behavior is that there's two different types of antecedents, and I'm not going to go into depth in this, but I just want you to understand that sometimes what's going on in your child's life are things that you may or may not see. So setting events, let me just give you an example from our own lives. Think about, you get up in the morning and there's no coffee in the house. And then you go to your car to drive to work. And I know you can't believe this, but there's road construction in Indiana. And so you keep getting blocked in everywhere and getting to your job. And then you're looking at your gas tank because you realize that you're running on fumes. And if you hit one more detour. So by the time you get to work, you're a little panicked and you may not respond in your most calm way. So for our kids, there are setting events or conditions that are increase the likelihood that they may engage in problem behavior. So those include things like anxiety. And I'm not going to read all these, we will be sending this PowerPoint, but you see there's a lot of things that can have an impact on individuals. I think the couple that I want you to think about are the skill deficits, and we'll talk about those in a second. And a big one is a lack of communication system. There is a really tight relationship between behaviors and communication. And over again, when we go in and we see individuals who are having problematic behaviors, one of the key parts of programming is really that they have some kind of a communication system in place.
And understanding that communication is often the first thing to go
Mhm.
when you are. So even if you typically are communicating verbally or in another way, it's going to be the first thing that goes. So we can't expect that you could say, well, what's going on or what happened? And we're going to get those responses, because just like us, when you're the most anxious or upset, it's hard to get the words out.
Mhm.
It's even more so with our kiddos that are trying to navigate their own behaviors. So to be patient and also think about another way I might get that information out that has no words, even for those that are verbal. Be just kind of think about what works for them.
Mhm. So, when you look at consequences, I think, we talk about consequences in terms of punitive approaches, but I really think it's important to focus on positive reinforcement as we're looking at kids. So we know that some children are reinforced by being yelled at. We know some kids are reinforced by being restrained because of the sensory input that they get from it. So we have to be very careful how we respond to behaviors and the fact that we may actually be increasing the behavior by our response. And so, that's going to be a really important thing to do. So, and again, realize that not everything impacting the individual's behavior is related to their autism. Sometimes it's related to health issues. Sometimes it's related to resources. Sometimes it's related to quality of life. One of the things that we've seen coming out of this pandemic is we're getting a lot more calls about kids with really significant behaviors, because life was changed. I mean, there were a lot of changes over the last 3 years, and we're seeing kids who are really bottoming out because they weren't kind of in those routines of school and such. And I'm sure some of you are struggling as well. So we always talk about teaching replacement behaviors. And so these are just some of the replacement behaviors that we talk about, problem solving skills, choice making. Choice making is so important. And, from a young child, you do give them choices of snacks, or choices of toys to play with. So thinking about how you build that in. Self-management and self-control, social skills. I remember one parent told me that she was constantly coaching and mentoring her son on social skills and then resilience and emotional regulation. So teaching those alternative skills. So let me be clear about this. And I just want to make sure that you understand what we're saying, that when a child engages in behaviors, it typically is that they need an alternative behavior. They don't have the alternative skill in their repertoire. So a man named Ross Green, who is a fabulous professional, says, if kids could do better, if kids knew better, they would do better. And so for some of our students, they really don't have those skills that I was just listing. So I think that sometimes we have to be very intentional in how we teach a child. So, there's something about the organization of your house and of their spaces. And one of the things too is that I have found more and more as I'm working in schools is that these are kids who get to hear about their behaviors. They're sometimes defined by their behaviors and their disability and never feel any kind of success. I've gone up to kids in schools and said, tell me the positive things about yourself. What are you successful at? And I've had more than one child, more than 20 children who have said, there's nothing that I'm good at. And so I actually sit down with them and I go through those things that they really are good at and tell them, please hold on to this piece of paper and rehearse it. We also know that it's important to provide very clear expectations because kids not only have expressive communication difficulties, but also receptive communication difficulties. We know that routines are really important, that folks do amazingly well with routines. And then, I think that we have to really make sure that we're really positive. I have a cousin who has 3 kids, and one we were concerned may be on the spectrum. And she is a special educator. And so she would say things like, when the child was getting into trouble, it's like, let's do this instead. And she really has focused on building rapport with her own children to make sure that she is a trusting person for them. And then, the thing about not overly accommodating, there's a few more that I want to go through with this, is that, all of us at IRCA are always looking at how are we preparing people for the future, And one of the things that I do know is that adult services don't have the support options that you have in school or in ABA programs or whatever. And so I've seen situations where kids have been so overly accommodated. So, for example, one family that I work with, and I'm not walking in their shoes, I'm not making a judgment. It just is something to think about. But with their child, if he didn't like the TV program that was on, they turned it off. If he didn't like the clothes, they bought him new clothes. If he didn't like what they had cooked for dinner, they cooked something else. And so every time that he didn't like something that they were doing, they accommodated him. And because of that, when he graduated from school, his options in life were really limited because nobody's going to accommodate like that. So just be careful that, I think that we have to make sure that we kind of push kids a little bit. And I say, push them to kind of the edge of the cliff, but never over the cliff, and always have support under them. So I also think it's really important that kids learn that they're not always going to win and know how to deal with losing as well. And that's going to build resilience. Betty Lou, what are your thoughts?
Yeah, my thought also is around people. Like, we know that people support our kiddos in a lot of different ways, but we also know that's not as sustainable as systems.
Mhm.
And so people are a great facilitator of systems, but if, say, for example, we've also seen individuals who may have had additional adult assistance all of their school lives, and then they can't sustain that into adulthood.
Mhm.
And so how you look at things, and the purpose of why we have additional adult assistance isn't to overly accommodate this kiddo, so when they're an adult, they don't have options, but how to use those people to help facilitate systems. So working with your school teams on that. What is the purpose of additional adult assistance? How will that help moving forward? But sometimes I think we think, let's put an adult. Now, definitely when there's safety considerations, medical considerations, that's a purpose. But how a lot of times with behavior, we just say, we'll add somebody, Cathy, and that doesn't
Right.
really facilitate problem solving. It just gives another person to take on the behavior piece if there's not true strategies. So those plans or those options for additional adult assistance should be very intentional so that they can build systems going forward.
We also know that our folks need visual supports, and that's across the age span. And just so you know, we have a full catalog of visual supports for free on our website. So please look at those. And the last one that I want to talk about, and if you have questions about these other ones, we're happy to answer those. But the next one that I want you to think about is shaping. And the thing that I want you to think about with shaping is to realize that change is not going to happen quickly. And I think sometimes we think that a child's behavior is going to go from 0 to 100 or 100 to 0 in just within a week of doing an intervention. And realize that at first, when you intervene with a child around their behavior, you may see an increase in behavior, but you've got to take little steps and celebrate those little steps. And, I've been working with some of the kids that I work with for years and years, and they've made progress, and we have to learn to celebrate every little step in that progress, but they aren't necessarily always there where we think they need to be in the future.
So Kathy, all behavior is communication, right? Sometimes
Right.
we think behavior, we hear behavior, and I always say we go to the dark side. Like we go to those, like we mean negative. Well, if you smile, that's a behavior. If you laugh, that's a behavior. If I wave at someone, like it's all communication. And so if we start asking, what are they trying to tell us versus why are they doing that? Like, I think that can help people just start to say, they're telling us something and we need to give them another way to do that. And we're shaping that
Mhm.
into something different. And that takes time because you are switching some of that communication piece, which it's like a different language sometimes, right? I think we have behavioral language and we're trying to shape that into something that is not just as appropriate, but it's going to be so much more meaningful for that individual as they move forward, because that's what isolates and ostracizes individuals, right? Is the negative things that happen.
Mhm.
And we don't want that to be. So really just digging into that.
So, the thing about success, find something around the house that your child can do and do well. I've been working in a school where with this one little boy I kept getting called down to see him because he was having such extreme behaviors. And he kept telling me he just wanted to help. So we have him going down the hallway with the janitor, collecting garbage. It's what he wants to do. His parents know he's doing it. And I cannot tell you the difference in him because he's doing something that he feels good about himself. So I know, we get the question is, how do we get rid of this behavior? And we're always thinking about how do we help this child be successful? What is it they can do that they feel good about themselves? So finding little things around the house that your son or daughter can do. And Betty Lou and I have worked with individuals from the earliest point of diagnosis till death. And we've worked with individuals who are nonverbal, highly verbal, and individuals who have all kinds of behavior issues. And in every individual that I've worked with, it's important to give them something to do that they can do and be successful at. And I've never found an individual that didn't work for.
And in the home, Kathy, they have a role there. Like we
Yeah.
expect as we have roles as adults, that siblings have roles. And that's part of our family culture, is that we all are doing something and being part. So if that is a ritual in your home and that individual's left out, it's sometimes we think, oh, they can't do that, or we don't want to push them to do something they don't want to do. Well, then that also removes them from some of the cultural or family rituals that you're doing. And so that's an important thing, is that by not stretching that kiddo at home, it can send a message to them. And if there's other siblings in the home as well, and other family members, we want them to feel included everywhere.
So let me back up for a second to be sure that we're being clear. So there are reactive strategies, and reactive strategies are used when you are in the heat of the moment. And the goal of those reactive strategies are really to minimize the behavior, to keep everybody safe, and to make sure that the child starts calming down. And then there are proactive strategies. And if all you do are reactive strategies and you don't focus on teaching your son or daughter an alternative skill, they probably will always stay in that reactive mode. And it takes a while to teach kids to do this. And, having done this for so many years, it can take quite a while to teach some of our kids to do things. So, and I think the hard thing about it is, and I was a teacher, Betty Lou was a teacher, and as a teacher for many years, probably the hardest thing is to realize what my role was in behaviors. And to realize that sometimes I had to change what I was doing to be able to impact behavior change. And so that's really hard, to be able to really assess ourselves and to think about how could we be responding in a way that's a little bit different so that we're not escalating behavior. And sometimes we know that folks need outside medical help or respite or counseling support is necessary. In the state of Indiana, we have something called a 988 number. And the 988 number is a crisis hotline for when a child is suicidal or there's a lot of behavior things going on, and they will be able to hook folks up to resources. the next step in the 988 is that they will be looking at putting together a mobile crisis unit and then maybe some other short-term options for folks. So we've been very involved in that process as well. So I think, changing behavior may take time, patience, and additional support. Know that we are always here for you. We're happy to problem solve via phone calls or emails, or to actually come in and visit with your son or daughter. And some of these kids, we know that they've got a lot of things going on. And I think, just having a clear picture of the child and really thinking about what are those alternative skills that you want to teach them. Betty Lou, any final words?
No, I mean, it is, once again, we don't know what it's like to live in the home, right? I mean, we totally understand that, being a parent or being a caregiver that's 24/7, whether they're present or not. If they're at a program or they're at school, they're still on your mind. There's still all kinds of things. But part of it too, I think, Cathy, is sometimes that can start to take over their lives and their families. So if you feel like you're just kind of stuck in this cycle, this is where we can help with that, like to talk through those. We always talk about our fairy dust. We don't have that, but we can help talk through some different things. And that's why when Cathy said, if you have specific concerns or things you want to talk about, it's because we have to probe. Right. Because the more probing we do, the more we know and the better understanding we have about what's going on in school. And, we do this with teachers. Know that we do this. This is what we do as staff, too, at schools, is the same thing where we do with families, to kind of probe so we can help guide in the best of way. But we understand and want to support you as much as possible.
So thank you all for being on this Zoom training. And we all want to wish you just the best holiday season possible. Stay well.